So today we're going to be talking about the healthcare system. Often the healthcare system is talked about in terms of the healthcare inequality, or like the access to healthcare. And usually this is analogous to economic inequality or things like that. So in economic inequality, people ask the question, like, what are society's obligations to its citizens? In terms of healthcare, the question is how much healthcare is a society obligated to give to its citizens, specifically usually like the least well off. Some people might respond, oh, it's what they can afford. There's a social obligation to give more than just what they can afford. We have a right to, take care of our citizens, or we have a duty and obligation to take care of our citizens. Or is healthcare itself a right that each citizen has? What does it mean for healthcare to be a right? Does it mean that they have some they have a right to a minimum amount of healthcare? How much is that minimum amount of healthcare? Okay, so we've been talking through this class so far just about like big picture issues. We've been talking about public health, and now specifically we're just going to talk about the healthcare system in general. Who should get healthcare, who should be providing it, and who should be paying for it. So when we're talking about this, we're going to be talking about it, we're going to be using the principle of justice. And remember, we're here talking about distributive justice. So, what is a just distribution of society's benefits and burdens? So, we might all think, everyone should, be entitled or, should have the ability to get as much health care as they want. Like, that seems like, our innate inside of us that's, our innate inclinations, I guess. But there's some hard realities. There's some hard limitations to how much health care an individual can receive. Not everyone can receive all the healthcare they want. It's just simply impractical. There are some, certain limitations that, we need to take into account. For instance, cost. Think about a heart transplant. It's going to cost $1.4 million. That's going to pay for the doctors, the OR, and all that. But on top of just, whether the patient can afford to pay for it or not, imagine the heart transplant is going to be subsidized. There's a limited amount of people who can perform heart transplants. There is a limited amount of, available, operating rooms. And on top of that, there just aren't enough organs to go around. So just because everyone wants a heart or a kidney, or, they need it to continue to live, doesn't mean that they're going to have access to it. So there's going to be some hard limitations on, how much healthcare we can distribute. But then also other things to consider is, different kinds of healthcare can have different benefits for different groups. So we should also be considering efficacy and efficiency. And then on top of that, we still need to maintain this healthy respect for autonomy. So we still can't be violating individuals' autonomy. So the American healthcare system, most people agree, is broken. Biden really hasn't done much about it, but it was a big campaign promise of Trump's that he was going to repeal Obamacare and make this better health care. Obviously, Obama made the Affordable Care Act. So those two presidents cared about it a lot. Although I'm not sure Trump did much except for try and repeal Obamacare. He didn't really seem to try and replace it with much. But either way, it was clearly a talking point for both of them. It's clearly important to their constituents. It's important to Americans, the healthcare system. And how it's working. So again, most people think that it's broken. The main causes most people think that it's broken is the high cost, the lack of access to healthcare through employers, or being ineligible for healthcare coverage, from the public services, so Medicare, Medicaid, things like that. So the consequences of being uninsured are, you're less likely to go get medical care. You're less likely to go get a prescription medicine, have a preventative test, or even if you do get the test, you're less likely to go get the follow-up results. People who are uninsured are 25% more likely to die. And then in the 2000s, so that, risk of dying translated to about 18,000 deaths for people between 25 and 64. These, I guess, would have been deaths that could have been prevented if they did have medical insurance. So as we were talking about, the Affordable Care Act, or Obamacare, was passed in 2000, I want to say 8 or 9. Obama was elected in 8, so probably it wasn't passed till 2009. I think it was passed in his first year. So in 2000, 69% of the insured got their insurance through their employers, which means 31% just got it privately and paid for it for themselves, or probably were on Medicare and Medicaid. I don't think a lot of people ever even pay for private health insurance. It's very, very expensive. So. And then, so again, right before Obamacare was passed, there was, in 2006, 2007, there was 90 million Americans under the age of 65 who were uninsured. So there's about 300 million Americans. If 90 million of them are uninsured, that means about 1 out of 3 Americans were uninsured between 2006 and 2007. And that's just people under the age of 65. Oh man, okay. So there was a higher percentage of people in that age range. So then the Affordable Care Act was passed. By 2010, Americans under 65, 49 million Americans were under 65 were insured. So it went from 90 million in 2006, 2007 to 49 million in 2010. That's almost half. So 90 million to 49 million. That's a crazy drop off. And again, it was because of the mandate that everyone had to have insurance. I think it was, otherwise you were like taxed a penalty. But yeah, anyway, you had to be insured. And then this also had an impact on where people were getting their insurance from. So as of 2011, 56 of the insured obtained it through their employer. So it went from 69 to 56. So about a 15% decrease, 13% decrease in people receiving it through their employers. I think it was that employers saw that, people had the public marketplace, and so they didn't, need to provide that benefit anymore. So a lot of people, have this preconceived notion that the uninsured are lazy. If they had a full-time job, they would be able to get insurance. But as I was saying, once the Affordable Care Act was passed, less people were getting it through their employer, either through costs or the employer stopped offering the benefits. So of the uninsured, about 75% of those are members of a family where they have at least one full-time worker. So they should be eligible for healthcare, but they're not eligible for healthcare in that situation. Okay, so then we were talking about other, social benefits, social welfare programs. So we have Medicare. So this is going to collect payroll taxes during your working years, and then pays for healthcare once you turn 65. My mom just turned 65 a few years ago, and she was super excited to stop paying for her private health insurance. She looked at it as getting like $1,000 a month raise. So yeah, and I hear a lot of other people get really excited around their 65th birthday. So yeah. Medicaid is another program you probably heard of. This is another public program. It's going to cover people under 65. This is going to include children and the disabled. But this is going to be, determined by the states. And so the coverage is going to vary from one state to the next. And because of that, yeah, unfortunately, in certain states, there's going to be a lot of people below the poverty line. They're just going to remain uninsured. So critics of the American healthcare system point out the high costs and the surprisingly low grade of standard of care. So this is a common criticism. I've heard this from multiple sources. Anytime anyone talks about the healthcare system, it's like, Americans are paying way more than everyone else, and we are not getting a lot more. And it's like, we don't have more sickness in America. It's like, why is this treatment the way it is? Or why is the cost the way it is? So we spend about $6,000 per person on healthcare per year. So if you take the average of all the other rich developed countries, their average was around $3,200, $3,300, about half of what America pays. Luxembourg was the next closest, so they were, it's an average, but Luxembourg was still the second highest, and I want to say they were around 5,000. So they're even spending $1,000 less per person. But I don't know. So even though we're spending so much, we have lower life expectancy. So we have about a 77.8 year life expectancy as compared to, again, the average of those other very rich developed countries in Western Europe. We're 78.6, so a little over a year, a little less than a year, I guess, 0.8 of a year. That's a few months. But then also Americans have a higher infant mortality rate. So we lose about 6.4 babies per 1,000 births, as opposed to 5.4 deaths per 1,000 births, again, in the other rich countries in Europe. So the American technology system, or the American medical system, isn't completely broken. We do lead in terms of like medical technologies. We're great at creating new things. We also have lower wait times for non-emergency surgeries. I imagine these are more non-emergency surgeries. I hope those aren't cosmetic surgeries, because that wouldn't necessarily be a good thing to brag about, but whatever. But yeah, so non-emergency surgeries. But we also have a higher rate of medical errors. We have fewer physicians per capita. Americans have trouble getting appointments on nights and weekends. I don't think I've ever been able to make a same-day appointment with a doctor. If you go to student health you have to make an appointment with a doctor to get an exam, I think the next time they can see you is 4 weeks to 6 weeks out. It's insane. I don't think I've gotten a doctor's appointment at student health within a month. So I definitely know where that's coming from. Okay, some more healthcare in the United States. So it's usually managed through, it's allocated through managed care. So there's two main systems. There's the Health Maintenance Organization, HMO, and the Preferred Provider Organization. So this is a PPO. So these are kinds of healthcare systems. So what they offer you is they're going to offer you discounts for healthcare within their network. So they have a network of providers. They're going to have a dermatologist. They're going to have a cardiologist. And so when you need to go see a specialist, you get a discount for going to see one of their specific doctors that they have a prearranged agreement with. So this is to try and control the cost. And so they also try and control the cost by influencing the kinds of care and the amount of care and restricting that to individuals. So, they might say, oh, we'll cover this, but not this. We'll cover, maybe a pig valve for your heart transplant, but we won't cover a synthetic valve. And maybe it's because of the efficacy. Maybe it's because, of the FDA approvals or whatnot. Who knows why? But it's all usually in the vein of trying to limit cost. And then critics of this are going to say, so focusing on this efficiency and trying to control costs is at odds with patients' welfare. A doctor might be less likely to pay attention to a patient's needs if they're, rushing and they're trying to see more and more patients to make more and more money, or, be more and more efficient. They might not decide to order necessary tests, or they might, refuse to treat certain problems. This can also just, straight up erode the trust in the medical community. So the Affordable Care Act, as I was saying, also Obamacare has helped out a decent amount. So I looked at the stats in 2018. There was 91.5% of Americans had health insurance. That is a huge number. So it looks like there's 8.5% of Americans who are still uninsured. And healthcare costs rose at their slowest rates in the last 50 years following the Affordable Care Act. So it actually has limited and controlled the rate of inflating healthcare costs. Okay, so this law is still, or the act, the Affordable Care Act, is still highly politicized, as I was talking about, with Trump. There seem to be a lot of Republican-backed initiatives that are seeking to repeal the provision. For instance, states can opt out of the Medicare expansions. As I was saying, Medicare is dependent on states, so they have the right to decide how much Medicare to give out. No, Medicaid. So Medicaid is the people under 65, the disabled, the children, things like that. So states are in charge of that, and employers also. This was the Hobby Lobby case. Employers don't have to provide contraceptives to their employees. But still, a majority of Americans like having health care. A majority of Americans, seem to see the necessity for having healthcare, for having coverage, all of that. So it seems like it's going to be something that's going to stick around for a while at least. So as I mentioned, talks about healthcare are often related to talks about justice, the principle of justice. So the principle of treating people fairly, or people getting what is fair, or their just desert. Another way of thinking about this is everyone should be treated equally, or like people should be treated alike unless there's a morally relevant difference. So when we're talking about healthcare, we're often, and specifically applying the principle of justice, we're talking about distributive justice. We're not talking about the retributive justice. We're talking about how society's benefits and burdens should be distributed. So as I was saying, this debate often relies on background assumptions and background theories about justice. So you can either criticize someone's argument about their, argument for certain healthcare limits or things like that, or you can, try and criticize their assumptions about what justice is. Okay, so what the main theories of justice, I'm going to give a brief summary of them. This definitely is, you would go over this for weeks and weeks in a political philosophy class. If you're interested in that stuff, definitely recommend it. So first we have the Libertarian theory of justice. This is the idea that benefits and burdens should be distributed through fair workings of the free market. The government's role should be limited to the night watchman, which is just protecting the individual's freedoms and the ability to participate in the market economy. Beyond this, the government doesn't really have a duty to redistribute the goods and services to make it more fair. So they're not trying to say everyone isn't fair and equal, or everyone isn't equal or has the same worth. They're saying, look, everyone has the same worth, but that does not entitle everyone to healthcare, especially healthcare provided by the government. It would be unjust for the government to coercively redistribute these benefits. So it would be wrong for them to tax some people and redistribute that to the people who are in more need of it. On the Libertarian framework, a state-run healthcare funded by taxes would be unjust. Okay, so as I was saying, definitely, if you're interested in theories of justice, check that out. This comes from historically, more recently, from Robert Nozick. Robert Nozick also kind of recanted a little bit on this, and was saying, hey, what we actually get from society is a lot more than what we're putting in, so maybe, we could justify more than this super minimal state, but that was recanted about 50 years after he wrote the libertarian, doctrine we have now, and so a lot of people are still stuck in that way and haven't come to the same realization he came to later in life. But this is still a theory of justice. This is still one we need to take seriously. Just because he recanted it doesn't mean other people recant it, and I'm sure there's people in this class who still, hold to this libertarian idea. But there definitely are problems with this libertarian idea beyond just applying it to healthcare. There are problems with the theory itself. So utilitarianism, the utilitarian approach to justice. So a just distribution of benefits and burdens is one that's going to maximize the net good or the utility of society. So there are some instances where the reallocation of certain of society's resources is going to be just, if and only if it's going to, add to the overall net utility of the society. So it can be justified if it's going to, giving people certain health care or redistributing certain things is going to be justified based on this idea of principle of utility. Is redistributing these benefits and burdens going to be better for net society as a whole? If so, then do that. So there's a lot of different ways and there's a lot of different considerations to take into when you're doing these measurements of benefits and burdens and utility calculations and whatnot. So depending on what you do, what you take in, and how you perform those calculations, this utilitarian approach can justify a lot of different kinds of healthcare systems, from minimal healthcare systems to pretty universal healthcare systems. It depends on what considerations you're taking into account there. So last we have this egalitarian point of view. This is going to be more historically from the John Rawls point of view. This is a theory of justice. This was the contrary to Robert Nozick's Anarchy, State, and Utopia, the libertarian point of view. So the egalitarian point of view is going to be on the other end. It's going to say that benefits and burdens should be distributed equally. So unlike the libertarian approach, the government can interfere with the workings of the free market to adjust and redistribute benefits more equally. So unlike the utilitarian approach, utility is not like an ultimate overriding factor. So, maybe we use the utilitarian calculations, but it's not going to be the thing that ultimately, the utilitarian calculations say this is what we must do. Because there's certain times where we see the utilitarian calculations and it's like, whoa, maybe we shouldn't be doing that. Maybe we're violating people's autonomy, things like that. Other considerations to be taken into account. So the egalitarian is going to be different than the libertarian and the utilitarian approaches in that sense. And this view is going to say it's going to justify like this minimal amount of level of healthcare. And specifically, it's going to be provided for the least well-off. That's an important part of Rawls's theory, that he's really taking care of the least well-off. Okay, so in addition to these theories of justice from political philosophy, there's also this approach, and this doesn't really come from philosophy, but this is something that I've seen outside of philosophy, and the book comments on it too. It's interesting. A right to healthcare. So there are rights in philosophy. John Locke talks about rights. It's a long time, but there isn't a theory of justice that talks about a right to healthcare, things like that. But yeah, so let's think about what that means. Obviously, as I was talking about earlier, is it a right to all healthcare at all times? It doesn't really seem to be something like that. It might be this right to the more minimal level of care. But again, how much is that going to be? Okay, so what are rights? So a right is a bona fide entitlement to something. So, it's an actual entitlement to it. It's a real entitlement to it, not just this like, I want that thing. It's actually like, I own that thing. So you have ownership rights over it. So when someone has a right, that's going to impose a duty on someone else. So if I have a right, you have a duty not to interfere with me obtaining something. So that's a negative right. You have a duty not to interfere. And then there's also these things called positive rights. So you have a duty to help people in an effort to get something they need. So on this view, healthcare is, if healthcare is a right, it's usually seen as a positive right. It's a right that society is obligated to help provide other people. So again, a negative right is a right not to interfere with other people, or a duty not to interfere with other people. Sorry. And then a positive right corresponds to a duty to help other people. That's not super important. It's just, to get the rights language down and to think about, okay, so if an individual has a right to health care, then someone has a duty to give it to them. And it seems like it's society's obligation to do that. Or if I have a right to go in this direction, then you have a negative duty to not interfere with me. So that's kind of what it's talking about. But again, here in terms of healthcare, it's going to be a positive right. What do we have a duty and obligation to help people get? What kind of healthcare do we have an obligation to help people with? Okay, so thinking about healthcare as a right, and then going back to our three views of justice. So the libertarian would deny a right to healthcare just straight up. That's not going to be a part of their minimal state. Generally, they agree with negative rights, but they're not going to talk about positive rights. And they're definitely not going to say that the government has a positive right to help people with healthcare. So the utilitarian might justify a right to healthcare, but it's only going to be justified if it's about the maximizing utility. So it might be justified in some circumstances, but it might not be justified in others. So they call this like a derived right or a secondary right. And then other argues that it might not be a strong right, but it's one that outweighs certain utilitarian calculations. So it's like maybe we should throw out the utilitarian calculations in this instance, and it's stronger than just because it's beneficial for everyone. This is going to be the prudential argument. We'll get to that in a second. But yeah, so the egalitarian approach, as I was talking about Rawls. So why should we believe that there's a right to health care? So Norman Daniels is a philosopher. He's arguing from the Rawlsian point of view. He's going to take one of John Rawls's principle, the fair equality of opportunity principle. So he's going to say diseases and disabilities diminish a normal species functioning in that individual, and so it's going to restrict their range of opportunities open to them. But the principle of equal opportunities, or fair equality of opportunity, is that, look, we're all going to have this opportunity. We're all going to have the same access to these opportunities. But if you're sick or disabled, then you're not going to have equal access to them. So this is going to be Daniel's argument. People are entitled to a fair equality of opportunity. Adequate health care can protect or restore normal range of opportunities. So they have a positive right to adequate health care. Okay, so let's even grant, for argument's sake, let's suppose that there is this right to health care. It's going to be impractical for everyone to have a right to all health care at all times. As I was talking about, there's going to be certain limits. So how much and what kinds of health care do people actually have a right to? So most people are going to agree that it's not this stronger sense of a right to all health care at all times or whenever they want it. Rather, it's going to be this weaker right to a decent minimum level of health care. So this is going to be a basic level of care that would be universally available to everyone. It's going to be publicly supported, and it's going to be guaranteed to anyone who needs it. This makes sense. On this system, elective and non-essential therapies would also be available in the free market. So it's not going to say, hey, we're going to totally take over the free market of healthcare. We're just going to say, hey, there's certain procedures that we realize human beings need, and so we're going to offer those to everyone at all times. These might be annual checkups, things like that, regular blood tests, very basic things. But then anything beyond that, any therapeutic things or non-essential or elective surgeries, obviously those are going to be available in the free market. No one thinks that those should be regulated, or at least not regulated in the same way of free access for everyone at all times. But still, so we agree that there's this idea of a minimum level of decent health care. But where do we draw that line? There is so much healthcare out there, and it's there are a lot of possible ways to draw that line. So should we give people immunizations, against vaccines, things like that? Should we give people annual physical exams? Those two seem pretty easy, and they seem to be minimal things to give to someone that would have a huge benefit for not only them but for everyone. But then there's the idea of routine medical care. Where do you draw that line of routine? How much is normal? So then we also have heart transplants. Should you get an organ donation? Should that be something subsidized by this minimal level of healthcare? Or maybe not even an organ donation, but dialysis. If you can't get a kidney transplant, should we be paying for dialysis? I'm pretty sure right now, so there was a senator in the 70s whose brother had diabetes, and there was a shortage of dialysis machines, and he took his brother into Congress, and it changed the entire way we treat kidney diseases in America. And it's now all of a sudden dialysis machines became subsidized. There were more dialysis machines available for every Americans. I want to say the government owns the right to insulin, so everyone has equal opportunity and access to insulin. This seems like a good idea, right? But there are certain things that the government does offer and that are already minimum things. But so what about other things? So there are other really terrible bad diseases that we don't have a cure for. We have maybe experimental drugs, things like that. These are often called orphan diseases, so diseases that are rare, and the medical community doesn't see a profit in researching how to cure these because there's so few people who have them that they're not going to get money from the drugs that they're making. So then other things, obviously cosmetic surgeries. I'm not quite sure that should be included. But then maybe certain things like a cleft lip, that might be a cosmetic surgery, but maybe that's something that would greatly improve someone's quality of life. So then, as we talk about elderly people and the care that they get at the end of their life, how much should we give to them? Expensive but marginally effective care for elderly and dying patients. How much healthcare do they need? Do they deserve? How much is the minimum decency? So then, costly lifelong therapies for mentally impaired people who are never going to reach this normal functioning. So this is going to go back to Daniel's argument about there being a positive right to healthcare. It's everyone has a right to restore their normal range of opportunities, but if a person is so, if they're in a car accident and, they're mentally impaired for the rest of their life, they're never going to get to that, normal functioning of, what they were at before. So it's like, do they not have a right to healthcare? And it's like, oh yeah, no, they definitely should. So, Daniel's argument here is probably not going to include them, or at least his argument isn't going to say that they have a positive right to healthcare, because they're not capable of ever getting back to that normal range of functioning. So if healthcare is just to get us back to that normal range of opportunities, then these people might not have a right to healthcare. Okay, so you just have to adjust Daniel's argument there. It might be doable, or maybe this is an argument that, like, hey, we don't really have a minimum right to healthcare. So beyond this, there's other good reasons to think that we have minimum rights to healthcare, or that there is other instances of rights to healthcare, to think about it like that. So there are certain people who have been hurt by either the government's actions or private industry's actions. These are things called it's like there's these things called super sites or super. Oh shoot. Anyway, so imagine like there's radiation that leaks out and a town gets exposed. It's like, okay, the government has a responsibility to give those people health care, to take care of the problems. Or, if an industry did it, they have a responsibility to take care of the people that they harmed. So there are certain instances where you might develop a right, but this might not be a universal right for everyone. Another instance of people who might have a right to health care would be veterans. People who are honorably serving the society deserve to be taken care of, especially if that service to society is going to break down their bodies and they're going to need health care later in life because they helped and served protect society. Like, yes, clearly those people should have a right to health care. And then there's also this prudential argument, like I was talking about before, but this is going to be more along the utilitarian calculations that, like, hey, we might have a more productive labor force if we gave everyone health care, or at least a minimum amount of health care, or the idea that, for national defense, it's, we're going to have a better army. If we were invaded, we would be able to defend ourselves better if we were all more physically fit and healthy and ready to go and fight. Okay, so again, to come back to this idea that, maybe, we can't give out all the health care we want, but at the same time, giving people as much healthcare as they want is also a bad idea. There is this idea of too much healthcare can be a bad thing. So the opioid crisis, we talked about that last class, that's obviously a situation where they're overprescribing these, bad medicines to try and treat pain. But there's also a problem with overprescribing antibiotics. The antibiotics are really good at killing, bacteria, but the bacteria are becoming resistant to the antibiotics, so then we're getting these superbugs. And so then we create a stronger antibiotic, and then that kills the superbug, and then the superbug is becoming resistant to the stronger antibiotic. So then we try and create a stronger antibiotic, and it's that is a system and a cycle that is, we're starting to reach our limits on. Creating new antibiotics is not as easy as, snapping our fingers. They're actually very difficult. So yeah, this can have also major problems for heart transplants and a lot of different normal medical routine procedures that we depend on antibiotics to prevent infections. Otherwise, a lot of our modern medicine without antibiotics is going to go out the window. So whenever you have a virus or something like that, antibiotics aren't going to be helpful. They're actually going to be hurtful. So if you go into the doctor's office and you're demanding antibiotics, it's going to be bad for you, and it's going to be bad for the entire medical system as we know it. But then also on top of that, you can experience unnecessary stress and anxiety. So if you get a false positive, so you might go for a mammogram screening. They used to recommend women regularly get screened for mammograms for breast cancer. But they found that 1 out of 10 mammogram screenings turn out to be a false positive. So, you're gonna, get your mammogram, you're gonna find out that you have cancer, or you're gonna be told you have cancer, and it's gonna turn out that you don't have cancer 1 out of 10 times. That's what a false positive is. But then on top of that, even if you do have cancer, it might not be the kind of cancer that would kill you. There's slow-growing cancers that, the body can take care of itself, or cancers that grow so slow that it's never going to affect you at all. And then, honestly, the mammogram screenings, the fast-growing cancers, the ones that are going to kill you, are, so fast-growing that a mammogram screening is probably not even going to catch it. So yeah, they've stopped recommending that women go for regular mammogram screenings. Rather, they suggest regular physical exams. And then if you find a lump or you see something problematic, then they suggest going into the doctor and using the mammogram as like a diagnostic test rather than a preventative screening kind of program. Okay, so, those are instances where like too much healthcare can be a bad thing. But also, we might want to ask the question, instead of like, how do we pay for this giant medical bill? We could be asking the question like, why is the bill so much? So I'm not going to go too much into this, but there's an interesting history of like healthcare in America. And it started out as like originally a protection against these like rising healthcare costs. A few people would pay into the system and this pool of money, and it would like help the other people around in the system. But the health insurers eventually grew to have more power. So I think about this as like a labor union. So if you're trying to negotiate with your salary with your boss, you alone aren't going to be able to like have any leverage or negotiation there. It's pretty much whatever your boss is going to say. But if you, together with all the other employees, get together and form a union, then that union is now going to have a lot more leverage to talk to the employer and negotiate on all of your behalf. So collectively bargaining, things like that. So the insurers are going to have this like power of collectively bargaining for all of their customers for their insured. And so they're going to go to the hospitals and they're going to have all this power in the negotiation, and they're going to demand all of these discounts. And like we'll send you clients if you give us a discount. And the hospitals are like, okay, well, we need clients, obviously, we need patients, we need, to make money, all of that. So yes, we'll give you a discount, but, to make sure that we're still making money, we're just going to like give you a discount on these like crazy inflated prices. So literally they just started making up prices. They put it in their Price Master, which is just a big book, which says how much different things cost to different hospitals. This is like, so why is the bill so much? It's literally because like we say it is. It has no actual correspondence to reality. How much a Band-Aid costs, how much it actually costs to train that surgeon or rent out that emergent OR, things like that. So yeah, it started as this really good idea, but then, because everyone else is having insurance, it's creating these higher prices, and then it creates these insanely higher prices for people who are uninsured. And it literally like creates the ability to, either go and get healthcare, or it's so prohibitively expensive you can't possibly even go get it. So yeah, that's, the really crazy part. But yeah, those are the end of my notes for today. This is healthcare. There's more in the book on healthcare about organ donations, but we're going to do a whole chapter on organ donations, so don't worry about that today. But yeah, so today we were just talking about different kinds of healthcare, different justifications. Think about your theory of justice. What system do you think is like going to be the most just distribution of society's benefits and burdens? Specifically, the benefit of healthcare and the burden of living with illnesses or disease. Yeah, so just think about that, and I'll see you guys in class.